Well, October is a special month for me and so many other women because it marks Breast Cancer Awareness Month. As a survivor of this life-altering disease, I know too well the importance of regular screenings and, of course, early detection. So in today's Health Matters segment, which is sponsored by Mount Carmel, we're reviewing all the things that you need to know. And I would like to welcome to the show breast radiologist Dr. Priyal Patel with Mount Carmel. So good to have you with us today.
Yes, thank you for having me.
All right, Dr. Patel, I myself am an 11-year breast cancer survivor, so I know the importance of annual screenings, but I want to talk today specifically, from a doctor's standpoint. Tell us why it is so important to get those annual mammograms.
So breast cancer is very common, and it's a lot more common than a lot of people will realize. About 1 in 8 women will get diagnosed with breast cancer over the course of her lifetime. And in Ohio, it is the most common type of cancer. So right now, unfortunately, there's no way to prevent it. But the best thing that we can do is to catch it early, because that does lead to better outcomes and better prognosis. So it is important for women to make time for those mammograms, even during the pandemic. And, another thing is that a lot of women who have early breast cancer won't show any symptoms. So again, that's another reason why it's important to come in for your regular screenings so we can catch this disease early before any symptoms do develop.
And women often think that they know what a mammogram's like, but can you tell us, if somebody's never had it before, what is the process like?
Yes, so a screening mammogram is done for patients who are not having any specific breast symptoms or any specific issues. So when women come in for these exams, we take X-ray photos of each breast while it's in compression. And usually those pictures are done from 2 different angles. And then afterwards, the radiologist will look at those images to see if there are any abnormal areas in the breast. And then we can decide if there's any additional testing that needs to be done. And
you also have new innovative mammogram technology as well. Can you share those with us?
So all of our locations perform 3D mammography, which is a relatively new technology that involves taking multiple X-ray photos of each breast in order to create 3-dimensional pictures of the breast to get a more detailed view. We also offer something called automated breast ultrasound, which involves capturing ultrasound images of the breast. And this is recommended for patients who have denser breast tissue. And then for women who are at moderate risk for breast cancer, we offer something called Abbreviated Breast Mri. So this is something that involves radio frequency waves and strong magnetic fields to capture these images. And radiologists will look at these images, and they're very detailed views of the breast tissue. So it helps us pick out these very, very small abnormalities that we may not see on a regular mammogram.
So we know technology has come so far, especially at Mount Carmel, but I want to talk before we leave a little about the COVID vaccine, doctor. A lot of women have been maybe experiencing some swollen lymph nodes or something after, and so they want to know, is it safe to get a mammogram after? How long should they wait? Should they do it before? Where do you stand on that?
So getting a mammogram is safe regardless of your vaccination status. And if you have received the vaccine, or if you are planning on receiving the vaccine, we recommend scheduling your mammogram either before your first dose or about 4 to 6 weeks after your second dose. That's in regards to patients who are not having any specific issues and are coming in for their screening mammograms. But I would like to emphasize that if you are having any specific issues, or if you have any specific concerns, you should not delay your care, and you should seek help, talk to your doctor immediately, and make sure that you get the care that you need.
And I don't think we can emphasize enough, early detection is key. It is your best chance at beating breast cancer. So schedule the mammogram today. What is the best way to do that when it comes to Mount Carmel, doctor?
Yes, so if you are due for your annual mammogram, you can call to make an appointment at one of our locations that we have many locations across Central Ohio, so you can call 614-234-7400.
Okay, easy enough. I appreciate that. Thank you so much for being with us.
Yes, thank you so much.